Good day. Welcome. I am Olayemi Durotoye, pediatric consultant, in conjunction with El Gracia Child Health Foundation, Ogun State. Today, I'll be talking about limb deformities in children. Thank you for joining us. Of course, the limbs refer to the hands and the legs, the upper limbs and the lower limbs. And very commonly, we see children who are born, either born with or somewhere along the line, acquire one form of limb deformity or the other. So, in this kind of situation, what are the causes of limb deformities and what can we do about them? And the reason why we need to talk about this is because people who have one form of limb deformity or the other are usually a target of some form of social discrimination, either verbally or some form of stigmatization by their peers and their friends. And then this leads to the patient themselves having low self esteem. They feel like they are not able to achieve what they ought to be able to achieve if they had, their limbs complete. So that's the reason why it's important for us to talk about limb deformities, especially in children, and what we can do to prevent it and also to correct. Limb deformities can be congenital, that means a child being born with that condition, or acquired, maybe by one process or the other in life. Congenital limb deformities usually arise from either a malformation or an abnormal formation of the said limb while the child was in utero. And then in other cases, there may be that the limb was not even formed or does not develop well in utero, and then the child goes on to be born with it. Most congenital limb deformities can easily be picked up by an antenatal ultrasound before the child is born. And so, in this kind of situation, the child also goes on to have other forms of abnormalities checked to see whether that limb deformity occurred in isolation or in conjunction with other kinds of abnormalities leading to, one kind of syndrome or the other. So, briefly, if I may classify limb deformities, okay, acquired limb deformities, happen later in life after the child is born, either by one form of accident or incident. So let me start by trying to classify limb deformity or tell of the different types. For example, in the congenital classification, the child may be born with absent, one or two of the limbs may be absent, which is what we call amelia, in which one hand or one leg may be absent. Then another type is what we call missing digits. Missing digits may happen in which the hands and the legs are formed, but then one part of the finger or the toes may be absent. The child could also be born with what is called webbed digits or syndactyl, in which the web spaces in between the fingers are not, resolved in utero, and so the fingers are or the toes are fused together. Also, a child may be born with abnormally shaped limbs, which may occur if in utero there's abnormality in the positioning of the child, and so while the bone is being formed, it may be formed in an abnormal way, and so the child is born with that kind of abnormally developed limbs. Now let's talk about when the child is born. When the child is born, a child could also be born with what is called club foot. In clubbed foot, which medically we refer to as talipes, either equinovirus if it is shaped depending on the shape, either equinovarus or equinovalgus. So a child can be born with clubbed foot. Also, a child can be born with congenital hip dislocation, which may occur either in utero or in the process of childbirth. And this is usually detected in children when you carry out what is called the Ortolani's maneuver. And then you discover that the child has a congenital hip dislocation. Now, while the child, if a child is, what do we do if a child is born with a limb abnormality? Just like I said earlier, if it was picked up during the antenatal ultrasound, what should be done is that other forms of abnormalities should be checked for in the child, because the child in that in some kind of situations, the child may not have any organic abnormality or maybe any deformity in the formation of the organs. It may just be due to what is called amniotic bands. And what happens in amniotic bands is that if a strand or a strip of the amnion, or yes, of the amnion, which is one of the structures in the placenta, may get entangled around a formed limb, in which this band may strangulate the limb and lead to the limb being amputated off, the structure, either from the hand or the leg. So the child is then born without that limb being present. So in that kind of situation, the child may be fine, all the organs may be well formed, but then the child is born without, one hand or one leg or some parts of the fingers or the palms or the feet is being amputated off the child. So if a child is born with any of this kind of congenital limb deformities, what we should do is to check if there are any other organs or systems that may also be abnormally formed in the child. So the child should be subjected to, of course, a transfrontal ultrasound to check the brain, to check ultrasound to check other parts of the body, to check the heart, to check the intestines, to check every other organ of the body to be sure that whatever limb deformity the child has is either in isolation or in association with other abnormalities. Now, in the case of congenital hip dislocation, the child immediately should be sent to the appropriate, healthcare facility or healthcare practitioner to take care of this. Okay, now I'm going to talk about clubfoot. Clubfoot is common because many of the deformities that involve the limbs are usually not taken care of until when the child starts to walk or starts to crawl. That's when many caregivers will now start taking cognizance of the fact that, oh, there's something wrong with this child's hands, there's something wrong with this child's legs. I think from the moment it is discovered, the child should be sent to the appropriate quarters for the appropriate things to be done, especially in the area of clubfoot. It can be treated. It can be treated. And the way to treat this, the child goes to an orthopedic surgeon who does a series of manipulations and castings, and then the leg will assume its normal shape. And so it's better to do that when the bone is still malleable, when the bone can still, the shape can still be changed, compared to when the child has already grown, older, and then will have to go through maybe a complicated kind of surgery for the leg to be corrected. So also a very common limb deformity with children as they are growing up is what is called bow legs or genovarum. We call it genovarum. That is a bowing of the legs. Children, usually toddlers between the age of 1 to 3, because as they are growing, for those ones who have, who are chubby and have a weight, the weight bears down on the young bone, that is still malleable. So because of the weight, it may assume that bow shape, and thereafter as the child is growing up, the bone will lengthen, and then the shape will change. Same also goes for genu valgus, which is what people call knock knees. So as the child is growing up at that time, the legs will lengthen and then the shape of the leg will change. But if this persists, then we need to look at some what is called rickets or vitamin D deficiency. And there are a number of different classifications for vitamin D associated rickets or rickets generally. But let me just focus on the vitamin D deficiency kind of rickets. And this is due to the kind of diet that we take in our environment. A lot of our diet contains over processed food, which do not have enough nutrients, do not have enough vitamins in it. And so, and then also, vitamin D is important because I don't even think anybody in Africa should have that vitamin D deficiency, because we are exposed to the morning sun, which is a precursor for the formation of vitamin D in our skin. And so, with this, um, a child should have adequate exposure to the early morning sun, which helps to form the precursor, the vitamin D, and then it is formed in our skin, absorbed, the other nutrients are absorbed from our food, and then this leads to formation of good bones in children. And so a diet that is rich in calcium, rich in eggs, rich in milk, which are good sources of calcium, should be provided to a growing child so that they can have enough nutrients to build strong bones. And so this is a way of preventing them from having genovarum or genovalgum. But in children who, after their toddler age, this deformity persists, they need to visit the orthopedic surgeons, which of course they will know how they are going to treat the limb deformity. Also for cosmetic purposes, because people usually would discriminate against people who have either knock knees or bow legs, and then this kind of people are not able to achieve their final height in future, especially the ones who have genovarum. So let me also say this about rickets. Rickets is amenable to provision of vitamin D and calcium supplementation to children. And you see that once they begin the calcium and vitamin D supplementation, the bones become stronger. And as they grow taller, the shape of the limb will change, and then they can carry on with their life. So going back to those who have congenital limb deformities, for example, those who have missing limbs, also they will need some form of physical therapy, some form of occupational therapy, and also provision of prostheses for them to be able to use the limb effectively. So if a child is born missing an arm, missing a leg, they can have prostheses which can be fitted to the limb, and then they have occupational or physical therapy to be able to use that limb effectively. They can also have prostheses for missing fingers or missing toes. They can have prostheses fitted for those also. And just like what I said earlier, those who have webbed fingers or webbed digits can have surgery to have the webs released, and then they have physical and occupational therapy to be able to use the fingers very well. My time is fast spent now, but just before I go, a little more emphasis on the provision of adequate diet, good diet that is rich in calcium and exposure to early morning sun to foster the production of to for vitamin D absorption in the body, and also calcium to ensure the formation of good bones in our children. And then for the congenital limb deformities, the mothers need to take their antenatal supplementations very, very seriously. When they go to antenatal clinic, please ensure that the supplementation that is given to you, either in form of tablets or syrup that you're supposed to take, especially calcium, should be taken, because in this environment, most of our adult diet lack adequate calcium. So for pregnant mothers, they may need to take supplemental calcium to ensure good bone formation in the children. Thank you very much for listening this afternoon. I've been Olayemi Duro to it. Till I come your way next time, thank you and God bless.